Kindred Healthcare provides you with the most appropriate care setting when you are recovering from an illness or an injury. Here to provide further details on everything they provide is Cindy Martin. Good morning. Thanks for being here today.
Thank you.
We've been chatting a lot kind of in between the commercial breaks and trying to kind of break this down, because I think when it comes to healthcare and the different services certainly that you guys provide as well, it can be a little overwhelming, I think, for families to figure out, okay, where do we need to go for this? Do I have the choice? Do I have the option? Kind of break it down a little bit on what we're talking about this morning.
Absolutely. We're talking about post-acute care options. And from a post-acute care standpoint, there are many options that families don't know what they can take advantage of. And with Kindred, we offer most of them. So the options consist of home health and hospice. So those are services that are offered in the home setting. The other is a skilled nursing facility. Okay. So say they need a little bit more skilled care, they'll go to a skilled nursing facility. And then, of course, is assisted living facility. Okay. So that's actually right before the skilled nursing side. And then lastly is the long-term acute care hospital, which is what I represent with Kindred Hospital.
So kind of give us an example. Who is mainly, what are the patients that you're seeing there? What are the advantages of going to Kindred? Okay,
so from a long-term acute care hospital standpoint, those are individuals who are having multiple, we call it comorbidities. So they're dealing with a lot of illnesses all at one time. You may have individuals who have major wounds, they have some infections, some of them might be having respiratory issues. So when they're compounded with all these different illnesses, they need more time. They need more attention. My first thought
is why can't you stay at the hospital?
Right.
I mean,
right. And so the hospital is there for emergency care. So when it's really critical, they need to absolutely go to a hospital to have those issues immediately addressed. But a hospital is not long term. It is not something that where a person is supposed to stay for an extended period of time. And so that's where the long-term acute care hospital comes as an option. We have physicians that manage our patients day to day. They have lab work that's done on site. So all the things that you'll typically see in a hospital setting, we offer it. But again, we're licensed to manage them for a longer period of time so that they are ready to go to a lower level of care, like a skilled nursing facility or home with ALF.
And is that always the goal, to get them back home and to get them on that best plan of action?
Absolutely, yes.
Well, and I think, we were chatting, and I don't know if enough people know that they have an option. They may just assume when they're at the hospital that the first recommendation they get, that that's their only option, that that's what they need to do.
And that's why I'm here. So it's just to really kind of expand the horizon a little bit more, so that when you are having those kind of conversations, you could cast that a little bit more further out to see, hey, what is the most appropriate setting for my loved one or for myself if you're in that position. But again, as I mentioned before, there are some other options. So if long-term acute care is not really what they're appropriate for, which is what I represent, again, patients go home all the time. And so they need to understand that they do have home health options too. And Kindred does have a division that offers home health and hospice in the home setting. And we offer it right here in the market.
That's awesome. Well, if someone's watching this morning, what's the best way to figure out kind of how their personal, situation? I know you have a great call center. You encourage people, say, give us a phone call. Let's help us, break it down for you.
Yes. So I encourage everybody to call. It's called 1-866-KINDRED. Basically, what that is a call center. Only RNs are actually answering that line, registered nurses, and they are there to sit there on the phone for 30 minutes. I don't care, 2 hours, however long they have or need to have the story painted to them in terms of what's going on. And then recommendations are provided. Recommendations from a post-acute standpoint are provided to that individual, and it's completely unbiased, and it's offered to any and everyone who has concerns about that next option for their loved one.
Well, and there again is the number to call. Thank you so much for being here this morning. We really appreciate it.
Thank you.
Again, I always learn so much talking with you and your team. Thanks for all you do here in the community.
Absolutely, I appreciate it.
All right, we'll send it over to Natalie.